Okay. Is our bed count. So, and then we do about 30 outpatients a day, outpatient surgeries, PIs and outpatients a day, Monday through Friday. Of course, on the weekends we don't do the outpatients. But, and our emergency room is really busy. We have pretty high volume in the emergency room. I don't know what the annual patient count is, but it's probably several thousand. I'm not sure exactly, what it amounts to, but we get quite a few. Description, organization, service level, like I say, acute care, inpatient, outpatient, emergency services. Size, 189 beds, inpatient beds. Location, right here on 30th. Current technology systems. We use a system called Horizon Patient Folder, which is our imaging system. Okay. And we use a thing called STAR, which is our MPI, which is our master patient index. And so we have our records go all the way back to back in the 70s, so we can access when people were in and out. We've got microfilm that goes back into the late 80s. We can access all that information if we need to. Okay. So we have that all available here. We do have some paper records, because after we scan our records, we hang on to them for 6 months. Okay. And then we destroy them after 6 months. Okay. So we figure we've already captured all of our images. So after 6 months, we destroy those, and we continuously do that and save those, so that if we have any problem with our scanned image, we can just recover the chart and rescan it. Okay. That works pretty good. And our current, we're heading, like I say, in March of 2015, we're going to go on the EPIC system, which is a true electronic medical record. Okay. And it'll be across the Allegiant system. So Bergen and Midlands and Lakeside will all be on the same system. Oh, that's excellent. So we'll all be on the same system. We'll be able to, take advantage of that technology. We'll be able to have people working from anywhere on charts here at Creighton, or at Allegiant, out there at Lakeside or Bergen. You can have coders all over doing charts. And right now we have Conifer Health Systems, which is a revenue cycle management company, and that's who currently runs the health information management. Oh, okay. Any of the revenue cycle services are run by Conifer for the entire Catholic Health initiatives throughout the country. Okay. So we have them as our parent company, and they basically take care of all the revenue cycle, which is admissions and medical records and billing and all of that, and all the collections. And so we're part of that. So we're basically kind of broken up. We're not exactly part of Creighton University Medical Center. We're a contractor. Okay. So we do that. And so your next question, the purpose for and description of IMIT systems incorporated or being evaluated. Well, like I say, it's the EPIC system we're going to go to. And it's an electronic medical record. Your typical, all information gets put in up on the nursing units. It flows down through the system and is labs and imaging, and all that information is all combined into one patient record. You've got the patient's profile electronically and everything, all the billing, everything's handled from there. Okay. So you don't have paper going around. It'll all be electronic, and information will be entered at the bedside electronically, and it'll all go into the system, and then it'll be disseminated and brought to a central location, and people will be able to code through it, review it, do their audits and everything else just on one system anywhere throughout the country, because it'll all be electronic. You won't have to actually go look at an image anywhere. And so it'll be, that's the purpose of it, and it's called EPIC. We will be converting to that, like I say, in March of 2015. Overview of past and current implementation. Basically, it's been a genesis from the paper record, then we went into the imaged record, which was the next step, and that's where we're at right now. We started that in 98, and we're still there now, but we'll be converting 2015 to a true electronic record. And then from there, I don't know where it's going to go, but that's where we're headed. And with ICD-10 coming online, we're going to take that system and leverage it so that it makes the coding much more efficient. So it'll all be ICD-10 compliant, and it'll all work slick. So current implementation include barriers, costs, and other technical issues, training staff, etc. Well, the barriers right now with the ICD-10 implementation, there's a freeze on conversion from the current imaging system to the EPIC system. So they froze that until 2015. So next year, Bergen's going to convert, and then some of the other hospitals, but we've been held off till after implementation of ICD-10, because that happens in October of 2014. So they want to hold off on that for a few months. So March of 2015, we're going to convert, just so we can do one conversion at a time. That's basically the cost. I don't know. It's several million. I know that. The technical issues is just the infrastructure, which is already here, and the computers. We're going to use the same computers. It looks like currently a lot of our systems are off-site. We've got servers off-site that serve this hospital, and that will continue. The Epic system will be a networked system throughout Catholic Health Initiative, with each separate facility having their own. It's not a silo, but it's their own archive, their own information.
Okay.
So we can share information, but basically most of that information will be held in the Creighton University file. And so we'll have that there. Training of the staff, that's going to be ongoing. Staffing, we don't know what impact that's going to have on staffing at this time because we're still doing imaging with paper records. So we've still got our staff out here that are doing that. We anticipate that staffing will probably be less, just do the paperwork, but it'll probably increase to do some of the other maintenance because we have queues that we work for, like analysis and for coding and for operative report monitoring and what we call referral communications, where we can contact other doctors saying your patient was here and get them information and that kind of thing. So we can anticipate that a lot of the roles of people that are doing actual imaging now will change into some of those areas. So we don't know what staffing is going to be affected because we're pretty lean right now. We don't have a lot of extra staff. So. Was the desired impact or goal reached? Not yet. The goal is to connect all of the hospitals on one electronic record so that we can share information and have people working anywhere on, like for example, if we've got a backlog of coding, we can have somebody in Western Nebraska or Colorado or California work those coding queues. Whereas right now we can't do that. But that is the long-term goal, is to have it all. So we can kind of leverage our assets where we have them to take care of the backlogs where we need it. So that should help us there. The cost over the long haul will probably go down because you won't have to have so many different places with the same information, the same infrastructure. You'll be able to, do things from remote locations. So you won't have to have just duplication of services everywhere. So it should make it better. And so far, I think they're on track. They feel like they're on track with their implementation. I wouldn't recommend they do anything differently. I think this is just it's the genesis of you go from paper to image to electronic, and then from electronic, who knows how they'll modify that so that it's, you got your personal health record and they're going to make it a lot more accessible to the patients. And so, it'll grow to where you'll be able to be responsible for your own health care information. You'll probably be able to carry it on your laptop or whatever. It'll probably get to that point, but that's down the road. Other pertinent sections that provide further insight into the use of the HIT include other pertinent health information technology. Summary. Provide a summary including your 5 remarks relative to the project. Well, as far as the HIT, I'm not sure exactly what that's referring to, but it's just a matter of retraining the staff to do other duties that would, lend themselves to electronic records. So that will probably take some time, and we still aren't sure exactly what that's going to be, but that'll be the big challenge, is to get everybody up to speed on the electronic record so they can use it and do their tasks the way we need it to be done. So we'll get that done. And in conclusion, final remarks. The project's going well, and we've now taken on Catholic Health Initiatives as our parent company, and they have a bunch of hospitals throughout the entire country. And so we're going to tie all of those together with a single system, which will make us a lot more efficient. We'll be able to capitalize on, we wanted to have the whole duplication of services and things. So we'll be able to, as far as the IT infrastructure, it'll be one infrastructure, and you won't have one here that's different than this one, that's different than this one. So it'll make it a lot easier to work. So, and we'll also benefit from all these other people throughout the country to help us make it better, instead of, having to have a group of people at this hospital and a group of people at that hospital. It's good to have a wide variety of people that you can get to. So I think, in conclusion, it in the end will end up costing less money. It'll be more efficient. It'll get us to the meaningful use standard, which is what the government wants, and then we'll be set to benefit from that as well. So, that's the plan. That's basically it.
Thank you, sir. Can you state your name and your title?
My name is Patrick Burnett, and I am the manager here at the Creighton University Medical Center Health Information Management Department.
Thank you.
You're welcome.